When most people hear the word diabetes, their minds immediately jump to sugar, and it's understandable. After all, high blood sugar is the defining symptom. So naturally, the assumption is that sugar itself is the only cause. But here's the truth that most people never heard: diabetes, especially type 2 diabetes, is not just about sugar intake. It's about the hormone insulin, how often it's being triggered, and how resistant your cells have become to that hormone over time. Let's break it down simply. Every time you eat not just sugar, but also refined carbs, snacks, juices, and even some so-called healthy foods, your pancreas releases insulin. Insulin's job is to shuttle glucose out of the blood and into the cells. But if you're constantly eating, even if it's small meals or healthy snacks, you're constantly triggering insulin. Over time, your cells get desensitized to it. This is called insulin resistance. It's the root problem behind most cases of type 2 diabetes, and yet it's rarely addressed directly in conventional treatments. You can actually be insulin resistant for years before your blood sugar ever starts to rise. In fact, many people walking around with normal blood sugar levels already have severe insulin resistance. It's just that their pancreas is still pumping out extra insulin to keep that sugar down. But the damage is already happening. Fat is being stored, energy is dropping, inflammation is rising, and the blood sugar will eventually catch up. When that pancreas can't keep up anymore, that's when fasting glucose levels start to spike, and the diagnosis finally shows up. Now let's talk about the foods that cause this issue. Yes, sugar is a problem. That part is true. But the more silent culprits are things like breads, cereals, pastas, fruit juices, granola bars, and energy drinks. These are all glucose bombs. They raise blood sugar rapidly, and they do it without the sweetness warning that most people associate with danger. Even healthy snacks like fruit smoothies or low-fat yogurts can have 30 to 50 grams of sugar in a single serving. That's more than a can of soda. Here's where the deeper problem starts. People think that if they cut back on white sugar or stop putting sugar in their coffee, they're safe. But they continue to eat a diet full of high glycemic carbohydrates, which break down into sugar just as fast. That oatmeal you eat in the morning, that whole grain bagel, that so-called healthy protein bar. These are all insulin-spiking foods, and if you're eating them frequently throughout the day, you're essentially bathing your cells in insulin from morning until night. Even worse, many people try to eat small meals all day long because they've been told this will stabilize their blood sugar. What they don't realize is that this creates a constant insulin environment, never giving the body a chance to reset, heal, or burn fat. The result, progressive insulin resistance and worsening metabolic health, even if they think they're eating healthy. Here's the bottom line: high blood sugar is a symptom, not the root cause. The real issue is chronic elevated insulin, which comes not just from sugar, but from too many meals, too many snacks, and too many processed carbohydrates. Until that hormonal imbalance is corrected, no amount of blood sugar control is going to fix the underlying metabolic dysfunction. You sent 2 ChatGPT said, here is the full expansion of Keynote 2D. Myth: you must eat frequently to balance blood sugar, written in a motivational, clear, and metabolic health-focused style similar to Dr. Berg's tone. One of the most dangerous myths pushed on people with blood sugar issues, especially diabetics, is the idea that they need to eat every 2 to 3 hours to keep their blood sugar stable. This advice is everywhere. Doctors, dietitians, and wellness influencers repeat it constantly. It's based on the fear that if you go too long without eating, your blood sugar will crash and you'll feel dizzy, weak, or shaky. But here's the truth: this advice is not only outdated, it's harmful. It actually creates a deeper dependency on glucose, worsens insulin resistance, and blocks your body from burning fat for fuel. Let's take a step back and understand how your body is supposed to work. The human body is designed to be metabolically flexible, which means it should be able to switch between using glucose and fat for energy. But when you eat every few hours, you're teaching your body to only depend on glucose. You never give your system a chance to switch over and start using fat. As a result, you become completely reliant on sugar or carbs for fuel, and that's when you start experiencing the crashes, the dips in blood sugar that people fear so much, the fatigue, the brain fog, the irritability. These are not signs you need more food. They are symptoms of metabolic inflexibility. Your body has lost the ability to access stored fat for energy because insulin is too high too often. And remember, every time you eat, even if it's a healthy snack, you spike insulin. Even a small protein bar, a few crackers, a piece of fruit, or a low-fat yogurt will elevate insulin for hours. And if you're doing that 6 times a day, insulin stays elevated all day long. Now here's the big problem: chronically elevated insulin leads to insulin resistance, which is the core of type 2 diabetes and prediabetes. And what does the conventional system tell you to do about it? Eat more frequently. So you enter this cycle where you're being told to eat to stabilize blood sugar, but every time you eat, you worsen insulin resistance, which makes your blood sugar even harder to control over time. It's a vicious cycle that keeps people stuck. And unfortunately, medicated, intermittent fasting, or even just spacing your meals farther apart is one of the most powerful tools for reversing insulin resistance. When you don't eat, insulin levels drop. That gives your body a chance to lower inflammation, improve cellular sensitivity, and actually burn through the excess glucose floating around in your system. Over time, this helps restore metabolic function. And what's most shocking to people, their energy levels go up, not down. Their cravings go away. Their mental clarity improves. That's because their body is finally tapping into its fat reserves, which is what those reserves are there for in the first place. You see, the body doesn't need a constant stream of food. That's a modern belief, created by the food industry and reinforced by outdated science. In truth, your liver stores glycogen, your muscles store fuel, and your fat cells are packed with energy. But you can't access any of it if insulin is always blocking the door. That's what frequent eating does. It locks your energy stores away, leaving you dependent on the next snack to get through the next few hours. People assume they need to keep the fire burning by feeding it constantly, but your metabolism is not a campfire. It's more like a hybrid engine. It runs best when it can switch between fuel sources. And right now, most people are running on a broken system that only uses sugar and only works as long as they keep feeding it. That's not metabolic health. That's metabolic dependence. If you've been told to eat every few hours to control blood sugar, question it. Step back and realize that your body already knows how to stabilize itself. If you get out of the way, give it space, lower insulin. Teach your body how to run on its own stored fuel instead of relying on constant outside inputs. That's how true healing begins. Yuseti ChatGPT said here is the full expansion of Keynote 3D. Myth: whole grains are safe for diabetics. Written in the educational, motivational, and myth-busting style you requested, one of the most misleading ideas in modern nutrition is that whole grains are safe, even healthy, for people with blood sugar issues. This advice is given constantly to diabetics, pre-diabetics, and anyone trying to manage their weight or improve their metabolic health. You see it in meal plans from registered dietitians, hospital guidelines, and even diabetes associations. Swap white bread for whole wheat, replace white rice with brown rice, eat oatmeal for breakfast, and stick with whole grain cereals. It sounds responsible. But the truth is, this advice is one of the biggest reasons people stay stuck in the cycle of blood sugar problems. Let's be clear, just because a grain is whole doesn't mean it doesn't spike blood sugar. It still contains starch, long chains of glucose molecules that quickly break down into sugar in your body. In fact, in many cases, whole grains spike blood glucose nearly as fast as their refined counterparts. For example, whole wheat bread has a glycemic index similar to white bread. Brown rice doesn't magically turn into something safe for your pancreas just because the outer husk is intact. And oats, especially quick oats, raise blood sugar rapidly, often even more than table sugar in some people. This is the part that gets ignored. Whole grains still trigger a strong insulin response. That means even if you're not seeing a massive sugar spike, your insulin is still being released in high amounts. And if you already have insulin resistance, your cells aren't responding well to it. So the pancreas keeps producing more and more insulin, trying to force the glucose into your cells. And what happens next? You get cravings, fatigue, fat storage, and eventually worsening diabetes, all while thinking you're eating healthy. People are told to eat oatmeal for breakfast to lower cholesterol, to have whole grain crackers as a snack, or to replace white pasta with whole wheat pasta for dinner. But if you test your blood glucose after eating these foods, you'll often see spikes that are anything but safe. And even worse, these constant spikes prevent your body from ever shifting into fat-burning mode. You stay in a glucose-dependent state, driven by carb cravings and energy crashes, and every spike leads to more insulin resistance. What's often overlooked is the effect of whole grains on visceral fat, the dangerous fat that surrounds your organs. Elevated insulin levels caused by these grains drive fat storage in the liver, pancreas, and abdomen. This is why people eating so-called heart-healthy whole grains still struggle with belly fat, fatty liver, and type 2 diabetes, even if their calorie intake is low. Because it's not about calories, it's about hormones, and insulin is the most powerful fat-storing hormone in your body. Now, let's talk about what's in these grains beyond just starch. Whole grains contain anti-nutrients like phytic acid, which block the absorption of minerals like magnesium, zinc, and chromium, all critical for blood sugar regulation. They also contain gluten, which for many people creates gut inflammation, contributing to leaky gut, immune reactions, and systemic stress that further disrupts metabolic health. So not only are these foods triggering insulin, they're also making it harder for your body to function properly at the cellular level. And it doesn't stop there. Because of their carbohydrate load, whole grains often interfere with fasting protocols, making it hard to go even a few hours without hunger. That's because they raise blood sugar quickly, followed by a crash, and that crash leads to hunger, irritability, and more snacking. This pattern keeps your insulin chronically elevated and your fat burning completely shut off. it makes long-term healing nearly impossible. Killer. So when someone tells you to eat whole grains to control your blood sugar, what they're really telling you, without realizing it, is to keep spiking insulin and stay in the metabolic trap that created the problem in the first place. The body cannot heal from insulin resistance while eating high-starch foods multiple times a day, no matter how whole or natural they appear. If you want to reverse the process, you need to focus on lowering insulin, not just managing sugar. And that means cutting out the hidden triggers that are marketed as healthy. And whole grains are one of the biggest offenders. You said 4chat T said here's the full expansion of Keynote 40 myth. Insulin therapy is the only long-term solution. Written in a direct, educational, and motivational tone similar to Dr. Eric Berg's style. If you've been diagnosed with type 2 diabetes or even prediabetes, there's a good chance your doctor told you that insulin therapy is inevitable. Maybe not now, but eventually. The message is subtle but clear. This is a progressive disease. We'll try pills first, but over time your pancreas will wear out, and we'll need to start you on insulin. It sounds like a logical path, almost scientific. But what most people don't realize is that this approach doesn't address the root cause. In fact, it often makes the problem worse over time. Let's look at what insulin therapy really is. It's the medical process of injecting insulin, an already elevated hormone in most type 2 diabetics, into the body under the assumption that your pancreas is no longer producing enough. But here's the issue: insulin resistance, not insulin deficiency, is the driving problem in type 2 diabetes. And yet the treatment focuses on adding more insulin to a body that's already resistant to it. That's like turning up the volume on a speaker when the issue is that the person listening is wearing earplugs. It doesn't solve the problem. It just creates more noise. In the beginning, insulin therapy can appear effective. It lowers blood sugar quickly. But at what cost? The extra insulin circulating in your system causes increased fat storage, especially around the midsection and in the liver. That means you start gaining weight. And with more weight comes more insulin resistance. It's a vicious cycle. Your cells become even more resistant to the insulin, so you need higher and higher doses. Eventually, blood sugar starts to rise again, and medications are added on top of the insulin. What was once a manageable issue becomes a full-blown metabolic disaster. And this leads to complications, not just with blood sugar, but with cardiovascular health, fatty liver, inflammation, and cognitive decline. Most people think insulin is a harmless hormone. It's not. Chronically elevated insulin levels are inflammatory. They increase oxidative stress in the body, damage blood vessels, and feed the very processes that lead to neuropathy, kidney disease, and blindness in diabetics. So while insulin therapy may lower blood sugar on paper, it doesn't stop the damage from happening. It simply covers the symptom while the root cause gets worse in the background. So why does the system keep pushing insulin? Because it's protocol. It's standard care. It follows the outdated belief that type 2 diabetes is a one-way road, a degenerative condition that can only be managed, not reversed. But that belief is based on a system that never actually tries to reverse it. It's based on glucose control, not insulin correction. It ignores the role of diet, fasting, meal frequency, and food quality, the very levers that control insulin sensitivity. Here's what isn't being said. The pancreas in most type 2 diabetics is still producing insulin, sometimes more than a healthy person's. The problem is not a lack of insulin, it's that the body isn't responding to it. So why add more? The real solution is to restore insulin sensitivity, and that happens when insulin levels are allowed to drop. That means reducing the number of times you eat per day, cutting out high glycemic carbohydrates, eliminating hidden sugars, and tapping into stored fat for fuel through intermittent fasting. These strategies work because they address the true dysfunction, not just the blood sugar reading on a monitor. Some people may need insulin, especially type 1 diabetics or those with advanced pancreatic burnout. But for the vast majority of people with type 2 diabetes, the disease is dietary. And therefore, the solution is also dietary. When insulin levels come down and stay down, your cells can begin to heal. Your liver becomes more efficient. Your muscles regain their ability to absorb glucose. And over time, your body starts to do what it was designed to do, regulate blood sugar without outside intervention. The tragedy is that millions of people are told they have no choice but to go on insulin. They're not told that they can lower insulin naturally, regain control over their metabolic system, and actually improve, not just manage, their condition. They're not told that food can be more powerful than medication when it comes to hormonal health. They're told to monitor, medicate, and adjust instead of correct, reverse, and heal. And the result, a lifetime of injections, side effects, and slow decline, when the body had the capacity to recover all along. If only someone had shown them the way. You said 5. ChatGPT said here is the full expansion of Keynote 5e. Myth: blood sugar is the only number that matters. Written in a motivational, myth-busting, and health-restoring tone inspired by Dr. Eric Berg style for years, the focus of diabetes care and blood sugar health in general has been almost entirely centered around one number: your blood glucose level. You're told to check it in the morning after meals, killer. Before bed, you're trained to see it as the ultimate indicator of whether you're healthy or not. If it's under control, you feel like you're winning. If it's high, you're failing. Doctors prescribe medications to lower it. People obsess over what foods spike it. Entire treatment plans revolve around it. But here's the problem, killer. Blood sugar is not the root issue. It's a symptom. And if you focus only on that number, you will miss the deeper, more dangerous problem lurking underneath. The real issue is insulin resistance, not just high blood sugar. Insulin is the hormone that helps shuttle glucose from your bloodstream into your cells. When you become insulin resistant, your cells stop responding to that signal. And as a result, glucose starts building up in the blood. That's when your numbers rise. But the high blood sugar is the effect of a deeper dysfunction, not the cause. And here's the critical part: insulin resistance can exist for 10 to 20 years before your blood sugar ever becomes abnormal. That means you can have a normal glucose reading and still be on the path toward full-blown metabolic breakdown. What makes this so dangerous is that you could be walking around with normal blood sugar and chronically elevated insulin. And that's the real driver behind weight gain: fatigue, belly fat, or fatty liver, high blood pressure, PCOS, and even Alzheimer's. Elevated insulin keeps the fat locked in your cells, shuts down fat burning, and creates inflammation throughout your entire body. But because no one's testing insulin, it gets ignored. Most people have no idea it's even a problem until the blood sugar finally spikes. And by then, the damage is already deep. Think about it like this: if you see a fire and put out the smoke without touching the flames, have you solved the problem? Of course not. That's exactly what conventional medicine does with blood sugar. It gives you medications to lower the sugar, but it does nothing to fix the hormone that caused it to rise in the first place. That's why people stay stuck on medications for life, because the system isn't focused on root causes, it's focused on numbers. Even worse, many medications that lower blood sugar actually increase insulin. They give you the illusion of progress. Your blood glucose drops, but your insulin resistance continues to worsen. This creates a false sense of security. You think you're managing your condition when in reality, the underlying dysfunction is getting deeper. That's why you can be managed for years, and then suddenly develop complications: heart disease, kidney issues, neuropathy, even though your glucose was under control. So what are the numbers that actually matter? Fasting insulin, For one, if your fasting insulin is high, that's a red flag, even if your glucose is still normal. Another key marker is HOMA-IR, which measures insulin resistance directly. Triglyceride to HDL ratio is another powerful indicator of metabolic health. If your triglycerides are high and HDL is low, it's a sign you're heading toward insulin resistance. And don't ignore things like waist circumference, fatigue after meals, intense cravings, brain fog, and inability to lose weight. These are signs your insulin is out of control long before your glucose meter catches up. If we're serious about reversing metabolic disease, we need to stop focusing on glucose as the only metric that matters. Blood sugar is just the tip of the iceberg. You need to look at the full hormonal picture. You need to understand the patterns, what you eat, when you eat, how often you spike insulin. Because it's insulin, not glucose, that's running the show behind the scenes. And the amazing thing is, when you focus on lowering insulin, not just blood sugar, your body starts to heal. You stop craving sugar, you lose fat, especially visceral fat. Your liver function improves, your energy goes up, and your blood sugar, the number everyone obsesses over, starts to normalize on its own. Not because you forced it down with drugs, but because you fixed the metabolic machinery that was broken in the first place. Focusing on blood sugar alone is like treating the symptom and ignoring the disease. It's time to shift the focus. It's time to stop chasing numbers and start healing the system that controls them. Your body is capable of recovery, but only if you look beyond the obvious and address what truly matters: insulin.